Here is detailed information on aspirin, structured according to your requested format. SNAT 1. Generic name, drug class, brand name. Generic name, aspirin. Drug class, nonsteroidal anti-inflammatory drug, antiplatelet agent, salicylate. Brand names, Ecotrin, Bayer aspirin, Bufferin, St. Joseph aspirin, Ascriptin, and others. 2. Definition. Aspirin is an over-the-counter, OTC medication used for its analgesic, pain-relieving, antipyretic, fever-reducing, anti-inflammatory, and antiplatelet blood-thinning effects. It is one of the most commonly used drugs worldwide. A3. Mechanism of action. Aspirin irreversibly inhibits cyclooxygenase, COX-1 and COX-2 enzymes, which prevents the conversion of arachidonic acid into prostaglandins and thromboxanes. Prostaglandins, pain, fever, inflammation. Thromboxane A2, platelet aggregation, blood thinning. And 4. Indications. Pain relief, headache, toothache, muscle pain, fever reduction, inflammatory conditions, e.g. arthritis. Cardiovascular prevention, prevention of myocardial infarction, heart attack, prevention of ischemic stroke, used in patients with coronary artery disease or after stent placement. 5. Contraindications, allergy to aspirin or other NSAIDs, active gastrointestinal bleeding or ulcers, hemophilia or bleeding disorders, children, teenagers with viral infections, risk of Ray's syndrome, severe liver or kidney disease, third trimester of pregnancy, risk of premature ductus arteriosus closure. 6. Before taking this medicine, precautions. Inform your doctor if you have asthma, peptic ulcers, kidney liver problems, high blood pressure, gout or hyperuricemia, history of bleeding disorders. Avoid alcohol, increases risk of GI bleeding. Discuss use if pregnant or breastfeeding. How to use. Take orally with food or a full glass of water to minimize stomach upset. Swallow enteric-coated tablets whole. Do not crush or chew. Follow your doctor's dosing instructions or label directions carefully. 8. Dosing information. For cardiovascular prevention, low dose, 81 to 100 milligrams once daily, baby aspirin. For pain, fever, or inflammation, adults, 325 milligrams to 650 milligrams every 4 to 6 hours as needed. Max dose, do not exceed 4 grams a day without medical supervision. 9. Miss a dose, overdose. Miss a dose, take as soon as remembered, but skip if it's almost time for the next dose. Do not double the dose. Overdose symptoms, ringing in ears, tinnitus, rapid breathing, nausea, vomiting, confusion, dizziness, seizures or coma, severe. Call emergency services immediately for overdose. #10. Stop or avoid taking if. Signs of an allergic reaction, rash, hives, swelling, trouble breathing, blood in stools or black tarry stools, vomiting blood or coffee ground-like material, severe stomach pain, unusual bruising or bleeding. 11. Side effects in detail. Common side effects. Stomach upset, heartburn, nausea. Serious side effects. Gastrointestinal bleeding or ulcers, hemorrhagic stroke, bleeding in the brain, tinnitus, especially with overdose, bronchospasm in asthmatic patients, hepatotoxicity, rare, kidney impairment in long-term use. Allergic reactions, anaphylaxis, angioedema, urticaria. 12. Vital information. Do not use in children with viral infections, risk of Ray's syndrome. Low-dose aspirin is beneficial in preventing heart attacks and strokes. Only in select populations. Always tell your doctor or dentist you're using aspirin before surgery or dental work. 13. Others that will affect aspirin. Anticoagulants, e.g. warfarin, heparin, bleeding risk. Other NSAIDs, e.g. ibuprofen, naproxen, aspirin's antiplatelet effect, GI risk, corticosteroids, risk of GI bleeding, SSRIs, SNRIs, e.g. fluoxetine, sertraline, bleeding risk, methotrexate, aspirin may increase toxicity, ACE inhibitors, diuretics, effectiveness when combined with aspirin, alcohol, GI bleeding risk. Thank you, have a nice day.